Welcome. Today we will learn about the various Medicaid Buy In or MBI programs that people with disabilities use to return to work or work more hours without losing access to Medicaid, called Medi-Cal in California. These programs are designed to support greater financial independence through employment while offering vital healthcare coverage. Important note for everyone: before we start, this presentation doesn't determine if someone may be eligible for Social Security disability benefits or other government services. The information presented today is general and may not include the most recent changes related to today's topic, including annual income limits. Rules and programs can also change with new laws or updates, which may not be reflected in today's presentation. We recommend that you consult directly with Social Security, a work incentive planner, or other professionals to get accurate information that best fits your personal situation. Let's get started. Medicaid Buy In or MBI is a supportive program for people with disabilities who receive SSDI or Social Security disability insurance, who are working or want to work, and who want to keep their Medicaid coverage. It ensures that working does not mean losing Medi-Cal or Medicaid benefits. 48 states have MBI programs, and these programs allow for earning levels well above traditional limits, often over $60,000 annually once earned income deductions are applied. Importantly, no two state Medicaid buy-in programs are exactly alike, as each state designs its own plan. This includes how much you're allowed to earn, what benefits you get, and whether your health care remains, which means you'll need to check the details for wherever you live. If you are not in California, it's important to check your state's Medicaid agency website for specific details about the program in your state. Medicaid, sometimes called medical assistance, is called Medi-Cal in California. It is a health insurance program supported by the federal government and run by the states that provide coverage for low-income people, including those with disabilities. Every state offers a Medicaid program and runs its own version of the program within federal guidelines. The Medicaid Buy-In program for workers with disabilities was created by the Balanced Budget Act amendments of 1997 and expanded by the Ticket to Work and Work Incentives Improvement Act of 1999. Today, 48 states have Medicaid buy-in programs, allowing people with disabilities to work and maintain Medicaid coverage even if their income exceeds traditional income limits. Medicaid buy-in programs are known by different names in each state. In California, this program is called the Working Disabled Program, or WDP. It allows people with disabilities to earn income while keeping Medi-Cal benefits. California's buy-in program includes specific income, asset, and premium guidelines, so it is important to review current state-specific rules. Each state Medicaid buy-in program can have different rules regarding premiums, resource limits, and countable income exclusions. Some states allow higher income limits, while others may include spousal income rules in the eligibility calculation. Understanding general rules is useful, especially for people considering moving to a different state. Always check the specific rules for your state's program. California's Working Disabled Program, or WDP, is based on federal Medicaid buy-in guidelines, but the state sets its own rules about premiums, resource limits, and how income is calculated. For instance, California excludes certain retirement savings from asset calculations, while others do not. Refer to the latest guidance on the California Department of Healthcare Services, or DHCS website, for eligibility details and updates. To qualify for Medicaid buy-in, individuals must meet the SSI definition of disability, though they do not need to have received SSI. Eligible workers must have accountable income less than 250% of the federal poverty level, with all SSI exclusions applying. States may set limits up to at least $14,000 and may charge premiums or other costs. The MBI Basic Coverage Group was created by the Ticket to Work legislation in 2001. States can set income limits between 250% and 450% of the federal poverty level and resource limits between $2,000 and $20,000. Premiums can be set on a sliding scale based on income, but cannot exceed 7.5% of total income. This group benefits individuals meeting disability criteria and income or resource thresholds. Sliding scale premiums help keep coverage affordable compared to private plans. The MBI Medical Improvement Group supports individuals who lose basic Medicaid eligibility because their condition has improved, but they continue to have a severe medical impairment. To qualify, you must be engaged in paid work, working at least 40 hours per month and earning at least the minimum federal wage. This program allows you to keep coverage while moving toward independence. These questions guide discussions with benefit planners and Medicaid offices to help you understand both short-term and long-term effects. When considering your state's MBI program, ask about the countable income limit and how unearned income and spousal income are treated. Check the resource limit and whether retirement savings are excluded. Find out if your state offers coverage under the Medical Improvement Group, charges premiums, and provides work stoppage protection. Lack of awareness is a major barrier. Many workers eligible for Medicaid are unaware Medicaid buy-in exists. Professionals should integrate MBI discussions into employment counseling, vocational rehabilitation, and financial literacy programs. To wrap up, remember that Medicaid buy-in programs are designed to support workers with disabilities by allowing them to work without losing Medicaid coverage. Each state has its own rules, so it's important to check the specific details for your state. Understand the eligibility criteria, income, and resource limits, and be aware of the different names and premium details in various states. Use resources such as your local Work Incentive Planning and Assistance, or WIPA project, and your state Medicaid office to navigate eligibility with confidence. Thank you for your time and attention today. Now that you have learned about Medicaid buy-in programs and how they help workers with disabilities keep important health coverage while working, we hope you feel ready to use what you've learned to better understand your options, speak up for yourself or others, and take the next steps toward greater independence. You have now finished Session 19 and Module 3 and completed the California Department of Rehabilitation Benefits to Independence 101 program. Congratulations! Completing this course is a major accomplishment. It brings you closer to your job and money goals. Your hard work has given you important knowledge and tools to help you understand Social Security benefits and find job opportunities so you can thrive. And this is just the beginning of your journey. Keep using the support and resources available to you, like benefit counseling and follow-up services, to help you stay on track. You have taken a big step forward, and we believe in your ability to keep going. Stay focused, continue learning, and know that your path to freedom is within reach. Once again, congratulations on your achievement.